All right, so welcome back to another episode where I'm talking about, working in the US here as a Jamaican nurse. So if you haven't watched my initial video, please go ahead and watch that episode, and then you can watch this one as a follow-up. But either way, if you're here already and don't want to watch the other one, thank you so much. Just go ahead and continue watching. So in Jamaica, we don't have a system where we're punching in and out, and so we have less flexibility here in the US because of that. Because if you don't show up for the people them work at 6:38 and 6:40, 6:52, then you are gonna be considered late at 6:53. If you're the person who is like a workaholic, then you can actually maximize on making more money and work additional days. But I tell you, when you work 12-hour shifts, 12-hour shifts in the US, it's hard. Yes, it's hard. Because especially if you can't type, if you see, because you're not used to the computer and you have to run every second to be typing, then that can be a bit of a delay. But it's hard. You have to be checking off, you have to be scanning, you have to be doing this. And while it is good and it is the safest means for your patient, it can take up a lot of time. So even though you probably have 4 rooms, you're given 4 rooms, and you're supposed to be seeing your patients. Just imagine you're getting 4 new patients at once. You have to be like literally jumping, hopping from room to room. And so the doctors putting in orders, you have to be doing that. And can you imagine some of the doctors, when they're not putting all of the orders at once, they put in piece by piece. So some of them, they don't even, it's like they are not sure what the plan for the patient is. I like the doctors who, they walk into the room, they come up with a diagnosis, and they know that this is what is happening with the patient, and they put in all the orders for the patient. While you have some doctors who will go in and put in 1 order, wait for the result to come back, then they put in 2 orders, wait for the result to come back, and by the time you look, you're there with the patient where it could have been dispo in 1 hour, they're there for like 4 hours. And just imagine all of the turkey sandwich that you have to bring to all of those patients for 4 hours. No, I'm like in and out kind of method. You go in, you evaluate the patient, you figure more or less this is happening, because about 90% or 95% of your clinical evaluation is going to go towards the diagnosis. The other percentage, the other small percentage is going to be based off, your test and your results. But your patient in front of you, based on what they say, based on your examination, about 90% of that is going to come up with you formulating your diagnosis. And so I don't understand sometimes when they go and they put piece of order in. Me not like it because it slow me down. It slow me down because I am there thinking that I'm on top of things, because I'm going to be doing all of these tests for my patient. I'm going to do all of this for my patient. So when I'm done with this patient, the only thing I'm waiting on is result, and then I move on to the next one, because I would have gotten all of my tests and everything done, situated, EKG and everything done for the patient, and then from there. But then, because the doctors are in this thing where some of them are actually just putting in one order, it slows you down. You understand? Because you can't scan off anything without the order in place. You understand? So you have to be running back and forth, like just going in like circles to try and get one thing done for your patient. And so sometimes I don't really like that. I like the doctors who are to the point and getting things done. There are days when it's going to be a little bit of a delay because you might be waiting on something specific, and that's different. But can you imagine almost every day it's the same thing, and you're doing that for the entire day for all of your patient? No, me not like it. I know some persons probably like it because they get a chance to hang on to the patients for hours. That's them. I like good turnover on patients. All right. Here in the US, it's more of, I don't think you really nursing the patient. It's more of just pop in and just give them some pill and done. Yeah, you don't know anything about the patient. You don't even know probably why you're giving the pill. You just want to say, oh, this is for the pain. But you don't know. You don't hear what the patient is going through. We focus so much on just one aspect of the patient. And that is just something that I don't like, because a lot of times you are just like seeing the patient discharging, seeing the patient discharging, seeing the patient discharging. You're not developing a relationship. You're not building a therapeutic relationship with that patient. You're not hearing the patient. Sometimes it's more than the one that's a cut on the foot. It can be an abuse that is causing that cut. It can be a bunch of different things. The cut can be there because the patient probably don't have any money, and the patient is a diabetic who is not able to care for themselves. They're not able to get the necessary, meals. They're not able to get the necessary resources to attend to the foot. And so we totally forget that part where we're supposed to be advocating for a patient, all because it's about a health system that is wanting to make money. And I understand that, yes, the health system need to make money, but at the same time, if you're here as a nurse and you have a passion for caring for your patient, you're going to want to address, or, you want to spend time and ensure that your patient is comfortable. We all talk about patient experience, and patient experience is key, but it's not all about, rubbing the foot and putting on a yellow socks and giving them warm blanket and giving them turkey sandwich and ensuring that the call bell is at the bedside. It's not all about that. The physical, the emotional, the psychological, all of the different all of those needs you need to meet for your patient, because you're treating the patient as a whole. You're not treating the patient as just, oh, I'm there for the foot and that's it. Yes, we do focus assessment on whatever, but there are certain things that are contributing to the patient, and so you tend to forget that. And so I realized that's that. Another thing is that even though sometimes you probably don't have the resources at your facility, you might be tempted to continue checking in that patient. You don't have a case where, and I understand it's all about, the liability, the legalities associated with it, lawsuits and all, but sometimes you don't even get a chance to say to the patient, this is what the facility offers. The best facility would be that. But no, what you're tempted to do is get those patients check-in, and then after you get them check-in, then you discharge them and send them to another facility to do the same thing. Which, that part, I don't really like it, because at the end of the day, you're costing more hospital bills on that patient that they shouldn't have been getting. I can understand, like, if the patient is sick, really sick, symptomatic, that's different. You see the patient is stabilized, and there's always this thing called entails. But at the end of the day, I feel that if it is something that is chronic, going on for a while, and you say to the patient, hey, this is a situation, you've been having this for a while, I don't think it's going to hurt you to just step by the other facility that is appropriate for that patient, then you can actually get the care that you need. I don't see anything wrong with it, but you have to just kind of understand that you have to check in everybody. If the dead walk up to you and say, me already dead, but me need somebody to pronounce me dead, you have to check in the person. You have to check in them. You can't just say, well, you're already dead. Somebody just going to come and pronounce you dead and send it to a morgue. No, you have to check in them, because it's all about money making. You just have to get used to that. Another thing about the health system here in the US, it doesn't allow you to be a proactive. It doesn't allow you to be a nurse that critically think about what's going on. It allows you to be the yes nurse. So as soon as the doctor put in x-ray this, you just jump and say, okay, then you go do the x-ray. As soon as the doctor say, give this, you do it. It doesn't allow you to question and say, okay then, but this patient is here for this. Does this patient really need it? And so you find that some of the nurses, they're into the habit of just, the order is in, they give it. They don't even know why they're giving it. You understand? And so I don't really like that, because as a nurse, you're supposed to be understanding the pathophysiology. You're supposed to be understanding what is going on with the patient. You're supposed to be understanding why you're giving this patient this medication. And if it means that you're going to advocate for your patient, you talk to the doctor regarding it. Sometimes the doctors can put orders on the wrong patient just because they have an entire department seen. But that doesn't mean that you're supposed to just go ahead and give it because the doctor ordered it. No, find out why they need it. Because sometimes it's an error. Sometimes, they weren't thinking along that line. Or sometimes you probably have an option that is going to be better for the patient. And the doctor might just be like, that's smart. I'll just go ahead and do it. So don't be shy about the whole fact that, the doctors are trained for 6 years or 10 years to get their degree. And your opinion doesn't count. Every opinion counts, because at the end of the day, you're caring for the patient. You're caring for the patient, and then doing what is best for the patient is going to be key. And so I realized that here in the US, there's not much persons advocating for the patient, because at the end of the day, we're advocating for patient experience. Yes, that's the only thing we care about, patient experience. We're not advocating for the patient. Also, sometimes your managers, I feel that they don't really listen to you that much, because even though your cry might be this, they're focusing on totally different things. And so you find out that you are in a situation where you felt like, you're wanting to do something good, but management is not listening. They're not listening. They're not actively listening to what you're saying to try and make sure that your department is, functioning as it's supposed to be. And so, this is just it. Working in the US, it comes with a lot of, you have to be flexible. You have to be, adaptable. You have to be somebody that manages your time appropriately, because as I say, it's more of a business, and so you'll just have the ambulances just rolling in. You have somebody discharging a patient without you even knowing that patient is actually being discharged, and then by the time you walk in there to probably say, oh, you're going to be updating this patient, it's a different patient lying down in bed waiting for you to come and triage them. You understand? So you might just be walking around and you see 2 different patients in your room, and you're wondering where the other patients are, because there's not much communication as to what is going on, because it's more of, let's turn over this patient, get this new patient in, do whatever test, and done. They don't care whether or not you document anything, because that's not important. It's all about the dough. All right. And so you have to just make sure when you get here in the US, you have to be on your P's and your Q's, trying to ensure that you protect your own license. Try to make sure that you advocate for your patient in the right manner. Try and ensure that at the end of the day, you're documenting. Because if you don't document, dog name is up later. If you don't document, how are you going to remember what happens, years from now? And so you'll find out that some places, they're in this thing where it's all about the time. It's all about time, and so you don't get a chance to go ahead and put in your notes to say this is what you did before the patient get discharged, because they are all about turning over, making sure they see the most patients that they can. And so that is just something that you have to learn to deal with. If it means that you're going to find 2 minutes and just try and put in a note on that patient, especially those critically ill patients, yes, if you have to just find the extra 5 minutes while you're there and put in those notes, so you're always going to be behind, because you're trying to catch up on patients that have already been discharged or already been transferred to the floor. So you have to just find the time to go ahead and put in all of those notes, so that way you can feel safe doing your duties, and at the same time you're securing the little license that you work so hard for. Because everybody know that when you study in Jamaica, it's hard, especially if you had a tough journey through college. You don't want the simplest of things to be, causing you to be wondering whether or not you have a license next year. No. So you want to ensure that you practice in a manner that is going to be safe for your patient, safe for you, and at the end of the day, you're providing good results. So protect your license. Try to ensure that you document. Try to make sure that you're just safe in every aspect of what you're doing. Because as I say, at the end of the day, it is your license. You work so hard for it. Do not let one little silly thing cause you to mess up your license. All right. And so that's just working in the US. Yes, the money is good, but at the end of the day, the working environment, sometimes, as I say, the culture is different. Your culture is different from my culture. And so it's a total different ball game. You understand? You have to be careful with the choice of words that you use, because somebody might say this word is inappropriate. The other person might think it's being bullying. But you just have to be careful with the choice of words that you say. All right. You might feel like when you come into work, everybody's just like upset with you because nobody talked to you. They just pass you by, look, sit down right here so beside you. And then the only time they probably say something to you is when they need something. So you see somebody come and just stare you down. Now you're there wondering, okay, what's going on? And then, oh, where can I find this patient? So the culture is just a little bit different because nobody really acknowledges you. And so depending on your culture, you might find it a little bit, hard to deal with, because you're probably going to want to start walking in and being quiet and just move to your area and sit down. And it might be okay to them, but deep down in your heart, you know that it's not right. Because you come and you see the doctor, you see the nurses, and you just come and just pull out a chair and sit down. You're going to feel bad about the whole thing because that's not how you were trained. That's not how you were brought up. And so you are just going to be tempted to say, good morning, guys. And everybody going to be looking over to you and be wondering, okay, yes, good morning, if they do answer. Yes, especially if they don't get their coffee. If they don't have a cup of coffee in the morning, oh, Lord, they're going to be grumpy. If they don't have a cup of coffee, they're going to be grumpy. While you come in with a smile, chirping around. Yes, so it's a totally different ball game up here. So you just have to be understanding that, your culture is going to be different. And this culture is going to be way different when you get here. Because just think of it, you're the only Jamaican in the department. And they hear you say 1 or 2 words in your Jamaican language. They're wondering, what you just say? What's that? So it's going to be a total different, environment, learning different things, adjusting, trying to be flexible, working on your time management. So all of those are things that, when you work in the emergency room or you transition here as a nurse, those are things that you have to deal with. Another thing is, you don't really get much of a time to run to the bathroom because sometimes the place can be very busy, And it's because you don't want nobody dead on your license or on your shift. I tell you, you will be there and you want to pee, and it's like you only know the bathroom when your bladder start cramping up. Yes. It only because you're there trying to make sure you medicate this one and you say, oh, as soon as I finish this one, you're going to go to the bathroom. So you run over to that one. And by the time you look, the doctor put in order on the another one. And so you're just there going back and forth in rooms, trying to make sure that you medicate your patient, stabilize your patient, ensure that the patient is happy and everybody is happy. But at the same time, your bladder is not happy. Your bladder is not happy, So by the time you run to the bathroom and trying to get that urine out, the urine don't want to come out anymore. It changed its mind. So please, when you get here, just be on your P's and Q's and try to make sure that you work well. Try to make sure that you have good work ethic. But because of the culture of the department, it kind of prevents you from doing certain things. Don't get in that habit. If it means that you need to speak up for your patient, speak up for yourself, go ahead and do that, because that's the only way persons are going to understand. Now, if you know something is right, you go ahead and do it. If you do something wrong, go ahead and apologize. Go ahead and apologize. Everybody make mistakes every now and again. So if you do something wrong, you go ahead and apologize and you continue, you learn from your mistakes. All right. So as you go along and navigate through, you'll understand that working in a different country, it might be a little bit different than working in the US. And as you go transitioning and you learn, you adapt, you change, that's when things will eventually get better. So if you have any questions, feel free to leave them below. Remember to like, share, and subscribe to the channel. Turn that notification bell on so we can actually discuss more about nursing. And if you're new here, check out one of the other videos in my channel, and hopefully you'll find something that will encourage you to be a part of the platform. But please just remember to hit the subscribe button. Turn it on, turn it on. You have to see the D on it to say it's subscribed. Yes. So that way we can actually build on this platform, hear more stories, let's just talk about nursing and build each other as we go along. As usual, thank you for tuning in. It was nice talking with you. Bye.